Hi there, my name is Blaine. I'm here with Hanna and Matt, and we are here to present our capstone project on the cardiovascular health disparities in the African American community and how to implement an educational program within those communities.
Our PICO question is, within the African American community, can implementation of an educational program be an effective intervention to increase this population's knowledge as well as their willingness to seek heart disease preventative treatment? Cardiovascular disease has been the leading cause of morbidity and mortality for decades. Although this is an issue that affects all races, African Americans have experienced a disproportionate amount of burden related to this disease. Most of the factors that contribute to this burden are directly related to the social determinants of health. Some examples of these types of limitations that are negatively impacting Black communities include health literacy, housing equality, and availability of nutritious foods. The purpose of our education project is to educate leaders of Hamilton County's Public Health's We Thrive initiative on the importance of evaluating the community's social determinants as well as implementing a cardiovascular disease education program within the community in which they serve. This program consists of a wide variety of leaders in the community, including police officers, firefighters, nurses, seniors, and residents.
For our methods section, the first step of our project was to begin by locating research using several different databases such as Sentinel, Medline, and PubMed. Each group member compiled a list of possible articles that could be used for evidence in our project and appraised their evidence. Once we found the right research, we were then able to put together our objectives and goals for our educational session, which we delivered to the We Thrive program. The goals of our presentation are to increase knowledge on cardiovascular disease, specifically in the African American community, teach about the social determinants of health relating to cardiovascular disease and poor outcomes, and to increase the readiness of community members to start a cardiovascular disease education program. One survey, the pretest survey, was given before the audience had been introduced to our information. Our PowerPoint presentation then included background information, examples of successful educational programs, and way to implement these educational programs. The members of the program were then asked to take a post test in order to get complete results.
From what Blaine said earlier, we gave the We Thrive program members a pre-test and a post-test. The answer choices to the questions were asked ranged from strongly disagree to strongly agree. Members of the We Thrive program possess a range of basic to advanced knowledge based on effects of cardiovascular disease on African Americans. During the pretest, we gave a series of questions to understand how much the viewers knew about cardiovascular health disparities in African Americans. When we asked how much knowledge they had on African American communities and how they are affected by heart disease, 18.75% had minimal knowledge, 31.25% had basic knowledge, and 50% had advanced knowledge on the subject. 62.5% had no knowledge of interventions that the community is trying to conduct aimed at combating cardiovascular disease. When asked if they can identify risk factors that predispose African Americans to cardiovascular disease, 43.75% slightly agreed, 18.75% agreed, and 37.5% strongly agreed. 68.75% strongly agreed that cardiovascular disease is a pertinent issue within their community they personally serve. Once we finished the presentation, we gave the viewers a post-test to follow up with after we gave them further knowledge and teaching on this topic. When asked again how much knowledge they all had on African American communities and how they are affected by heart disease, 66.67% had basic knowledge and 33.33% had advanced knowledge. When asked if cardiovascular disease is a pertinent issue within their community they personally serve, 66.67% strongly agree and 33.33% agree. 100% agreed that they can identify risk factors that predispose African Americans to cardiovascular disease. When asked after receiving this education how interested are they in implementing these interventions into the We Thrive movement, 66.67% were extremely interested and 33.33% were very interested. Finally, we asked if this presentation helped enhance your knowledge on cardiovascular disease among the African American community, and 33.33% strongly agreed and 66.67% agreed. But due to the low response rate in the post-survey compared to the pre-survey, more research on the effectiveness of our evidence-based practice project is necessary. In conclusion, members of We Thrive program feel they have sufficient knowledge in regards to the health disparities and limitations that African Americans can experience, yet a wider variety of responses to our surveys would be necessary to have congruent results. The community leader of Forest Park may take into consideration some educational interventions to implement within their community. Finally, we as a group we're able to gain a stronger understanding of the effects of cardiovascular disease on African Americans and the importance of continuing research to find even more effective interventions.